Actually, my wife called the doctor she knows, and he told me I'm doing the right thing. He told me I should just be resting, icing, applying heat until the pain goes away. Once the pain goes away, which takes 4 to 6 weeks, then begin physical therapy. See, I'm not waiting to address the injury, I'm addressing it by resting it. I'm not using it. Also, I read that after a torn rotator cuff, you should keep your arm in a sling for 4 to 6 weeks. That's standard, meaning not using it, not doing anything that can make it hurt, letting it have full time to heal. Then, once that healing period has ended, you can begin slowly stretching, regaining range of motion, slowly re-strengthening, etc. Oh, that's why they're saying to go to a physical therapist so soon. Because the therapist will give you massage techniques. You gotta factor in a lot of things. Um, my initial injury happened specifically on September 30th. And throughout the first week of October, I was in pretty severe pain, couldn't lay on my shoulder, etc. Had to keep my arm how it is now, my right arm, kind of holding onto my shirt as a makeshift harness slash sling for myself, and just not moving it a whole lot. But by the end of that week, it was feeling a lot better, and I decided to YOLO go kayaking again. Big freaking mistake. And that's really where everything went downhill. I severely tore it, I believe, on Saturday. No, Friday, the 5th of October, while kayaking. And I felt the tear. I felt the pain. Um, now, I actually paddled in decent pain Saturday, the following day, anyways. Just completely ignorant of how serious this was going to be. Now, I then went back to immobilizing it and babying it for the second week of October, seeing that I was in kind of bad shape, but still trying to use it a fair amount and still trying to go about my normal daily activities without like truly completely stopping using my right hand. And that just enabled it to continue to tear without healing. So by about the last time I streamed, well, shoot. I want to say like the 16th of October. I had had enough. Let me make sure though on that timeline. Yeah, about the 16th of October is when things started getting really bad, and I had about had it, and I completely stopped using my right arm to allow for true healing and stop tearing things. So because I let it tear and tear and tear and tear and tear throughout the first half of October, I would say my healing phase truly began closer to about the 16th. So really, I'm not even to the 2 week mark. I would say about the 30th of October will mark 2 weeks. And I think that I should wait a full 3.5 weeks, or maybe 4 weeks, because of my age. I think it'll take longer because I didn't stop the tearing earlier. I think everything's just delayed. So I think 23rd, 30th, Tuesday, November 6th. Begin rehab. What do you guys think of that plan? Does that sound solid? Alright, so the initial rotator cuff injury occurred from whitewater paddling on September 30th. My arms got outstretched while holding on my paddle underwater in a very violent section of the river, and it ripped, overstretching my shoulders, and it overpowered me and tore my rotator cuff, which are the smaller muscles that control the humerus. It's all the muscles designed to turn the humerus like this and this, and also pull the humerus bone into the scapula, holding it in place. Your deltoid, your lats, your chest are bigger muscles that move the arm, but these muscles are mainly ones that just kind of hold everything in place and also do some of these more odd motions, like just twisting the rotator cuff left and right. Whereas the chest is just that, deltoid, that, lats, that. But these are like more fine muscles. And it's these finer muscles that got torn. So anyways, that's how it happened. And then those little tears just kept getting worse because I didn't stop using it and properly rest it. And I didn't research and take seriously my recovery process. I didn't know how much danger I was in. Nor did I know it would keep getting worse and send me into a state of utter agony and completely disable me from working. I had no idea. But at the end of the day, I would have probably needed to spend a multi-week period completely letting it heal and not moving it anyways. So at the end of the day, I just kind of delayed the recovery process, just letting it get worse and worse. Okay, so the best thing would have been when I initially tore my rotator cuff on September 30th, I didn't paddle at all. I took it very seriously, put my arm in a sling, didn't move it for 4 to 6 weeks. So that means I would have been to what I got to on October 19th. So almost 20 days later, I would have started that. So that would have saved me 20 days off my total recovery process. But I guess I delayed the recovery by 20 days by just not addressing it, not properly taking care of it, not beginning the do not freaking move it so it can heal phase. Okay. So that's what it comes down to. Because also, by not taking it serious and not letting it heal for so long, the tear got worse and worse. So the pain and discomfort that I'm experiencing during the multi-week don't move it at all phase is going to be greater. More agony, more discomfort, etc. Had I taken it serious and not moved it and completely stopped all use of it 20 days earlier, right after the original injury, I also suspect that my total don't move it and let it recover and even my rehab time would be shorter. So instead of waiting for a full 5 week recovery period, which I chose to be extra conservative for healing and total mobilization of the shoulder, to let the shoulder actually heal, that 5 weeks could have probably been bumped down to closer to 2.5 weeks because the tear wouldn't have gotten so severe and have gotten worse and worse. So that also would have been a benefit, is beginning the healing sooner and not having to heal for as long. So this whole holding my shoulder by my side and not using it and just using my left hand is going to be until November 28th. We're at 10/28. So we already did go through just under 10 days of this process of total immobilization. And we still have another full month of this to go. So another 4 weeks of using voice recognition software, not being able to type, doing very, very, very little, as much as I can avoid with my right arm, and focusing on living my life with just one arm. And I am beginning to adapt and come to accept what I can and cannot do and learn from my mistakes. So another month to go of total immobilization, after which point, beginning November 28th, we're going to begin our rehab, our physical therapy. And the first three weeks will be aimed at reestablishing range of motion and moving it around and light stretching. So it's just going to be, just trying to stretch it out, feeling pain, but just a little bit each day, just moving it around here and there. Maybe walking normal. Maybe doing this little exercise where you hold a weight in your hand with your palm facing out, and you just move it back and forth with your arm by your side, back and forth. Forward till it hits about your stomach, and then back till it's about your butt area. Just back and forth with about a 20-pound weight. And the idea behind that particular exercise is to lower your shoulder back into its socket. During the healing and immobilization process, your deltoid really tightens up, which kind of raises your shoulder up, and it kind of pulls it out of the socket. So when you try to reach over your head, it causes impingement because your humerus head is kind of lifted up higher in the scapula than the normal socket because your muscles have tightened up to protect it and let those internal ligaments heal. And so when you try to raise it, it's hitting the forks, the top of the humerus. It's bumping into them, and there's actual mechanical stoppage from being able to raise your arm up. And it also pinches various muscles and nerves when you try to raise your arm up. So it's very painful, and it cannot be done. You actually hit a roadblock. You can't raise your arm over your head. But by doing this exercise with palm out, where you go forward and back, while holding a 10 to 20 pound weight, it starts to relax those muscles and lower your humerus head down back into your scapula. So it's reestablishing the positioning. Next, you'll just be, trying to get things back and forth and just moving it every day, maybe an hour, maybe a couple sessions a day. Just little movements and stuff, trying to stretch and get your range of motion back, and nothing too crazy, nothing too painful, just little by little. And then following up each of those sessions with some icing to increase blood flow, and maybe also applications of heat as well to increase blood flow. And probably some Epsom salt baths would be good as well, because you're going to be causing some aching and pain during this, and you're going to be sore and getting swelling back. So you have to manage all of that. So that'll be 3 weeks worth for my rehab phase 1. The following 3 weeks, December 19th through January 9th, I'm going to begin light exercises designed to let you stretch and flex your joint as far as possible. Okay, so we're going to get into a little more breaking a sweat type of stuff, a little more aggressive exercises, maybe even like in and out. Maybe we can get one of those resistance rubber band things and connect it to something, and you do this type of stuff. Maybe we'll even do like some very light, maybe just body weight, just raising the arm up and down like this. Just different stuff like that. Although we can do that the first 3 weeks too, but this will be more resistance training than just pure plain old stretching and a little bit of movement. So we're getting into more exercise than just stretching and moving. And we'll, during this period, be slowly regaining our range of motion as well. During the final 8-week portion, we're going to be doing medium exercises. So we're going to be using a little more heavier weights, a little more serious on the workout side of things, starting to regain our strength, and obviously moving toward a full range of motion. So really pushing the envelope there. And during these last 2 phases, obviously icing, applying heat, taking Epsom salt baths, all of that will still apply. But we're going to be using it and just getting it back to normal during these times and re-strengthening it. And then obviously after this program's over, it will just be continuing to do weightlifting and getting back into my normal routine. But after March 16th, the idea would be that the shoulder will be rehabbed to a point where we probably don't need any more ice or Epsom salt baths or anything like that. We'll just be able to do our normal shoulder exercises and start working into lifting the same weights we used to, and even going beyond that, since I wanted to lift heavier in the first place back when I was able to lift. So that's a recovery plan and timeline. Close window. The guy said when he had a rotator cuff injury, the doctor put him in a cast for 6 weeks. 4 to 6 weeks is the typical period of time to immobilize the injury, to letting it fully heal before you begin rehab. I only have marked 5 weeks here. October 19th through November 28th. I think I should bump it up to 6 weeks, especially since this is something that I let get worse. I don't want to rush it. Oh, I'm 2 days shy of 6 weeks. I think I could live with that. No, I'm going to say I'm happy with that. We're only 2 days shy of 6 weeks. I think that's pretty conservative. Yeah. I think we're good. But that's key. That's so key, though. In all of these cases, these people don't keep their shoulder still for that 5 or 6 weeks, and that's how they get screwed. That's why it doesn't heal. Every time you try to move it, it re-tears it, reintroducing the swelling and the pain. You have to keep that stuff still for a long time, and only then can you expect full healing. And then you begin the gradual stretching and the gradual light movement, and then little by little you start introducing the light exercise, and then 3 weeks later you get into the medium exercise, which continues for a couple of months or a few months, medium exercise, before you can get into lifting more heavy weights. But the exercise should not stop after it starts. That's another thing I think people mess up. They either don't let it heal for long enough so that it just keeps getting re-aggravated, retorn, and can never fully heal because they refuse to stop using the arm. That's one thing that causes it to get worse and worse and drag on for years. And then the other big mistake is people that don't fully commit to the physical therapy / rehab portion or phase after that 4 to 6 weeks of complete immobilization phase where all the healing happens. So they never get full range of motion back, and because everything's super stiff and they never fully got their full range of motion and stretched it all out and got it all working again properly, and they just used it in a very minimal way and never really got it back to full functionality, then all the muscles remain too stiff and more likely to re-tear because they're too stiff, and you try to make a sudden movement and boom, you got to tear again. Now you have to go back to phase 1, which is letting it heal for 5 to 6 weeks without moving the arm at all. So people end up in this cycle. You have to let it fully heal and then be on top of it 3 weeks of slowly getting it moving, getting your range of motion back. Then another 3 weeks slowly getting it moving, adding in light exercises, getting your range of motion back. And then another couple months of medium exercises, getting your full range of motion back and building up your strength. And this is every day doing physical therapy, getting your arm fully back to full functionality. And if you do it that way, then 4 or 5 months and you're back to 100%. But people aren't willing to commit to the healing phase or the physical therapy phase, so they keep re-injuring. I'm going to do it right. And people aren't willing to research. I'm doing all this research, looking at case studies, looking at all the recommendations and articles, watching YouTube videos. I watched multiple days of YouTube videos now. I'm getting a full understanding of the entire structure of the shoulder, all muscles involved, all ligaments involved, all recommended exercises to re-strengthen the rotator cuff, how long the rest period should be, pros and cons of icing, pros and cons of applying heat, different types of soaking, different types of ways to relieve the swelling and pain, electrical stimulation therapy, ultrasound therapy, massage, everything there is to know, including how posture and spinal position affects things. I watched a lot of videos by a guy named Dr. Bergman who has amazing stuff. He's a chiropractor and a doctor, and he knows everything about the spine and how to rehab different injuries and how the spine and posture and neck posture can affect blood flow, and blood flow then can affect being able to properly heal different injuries. It's very interesting stuff and very important stuff to understand. At the end of the day, a doctor has 5 minutes when you show up to his office. He's not going to know everything or be able to gather every bit of information needed. It's up to you to use the vast resources of the internet to learn everything available to you yourself. And only then, if you don't feel you've figured it out and you're at a loss, then you might seek out a doctor's opinion. In my case, I actually did speak to a doctor on the phone for free because my wife works for a doctor's office, and his advice was until all the pain's gone, you need to be resting it, icing it, and applying heat. And that's exactly the phase I'm in. So he agreed with me. So that was reassuring just to see a real doctor who asked me a lot of questions about my situation to agree that I'm in the right course of action right now. So that gives additional peace of mind. So I definitely don't need to visit a doctor's office and pay $500 that I don't have. Like, that's ridiculous. If I had extreme weakness and felt something pop and actually tear in half fully or something like that, then I would want to go get an MRI done, but I don't think that's the case. This is just a tear, a strain, a sprain that just got out of hand. So that's why I don't feel the need to pay for any type of X-ray slash MRI stuff, which is $5,000 I don't have. When I say I don't have, yeah, I could probably come up with it, but what? Am I going to empty out my retirement savings and stock accounts? Like, no, absolutely not. I'm not going to screw over my entire financial future just to get a second opinion. I'm confident that I'm on the right path here. And that confidence grows the more research I do, where every article I read confirms my plan of action. That's the key. You don't want to read one article or one suggestion and say, oh, that's what I'm going to do. You read hundreds, you spend days researching, and then you can be completely confident. And that's well worth the time spent because you're saving thousands of dollars by not going to the doctor and doing your own research. You can diagnose and treat yourself 99 times out of 100. The full knowledge of medicine and mankind is available at your fingertips through the internet. There's no reason people need to always go to a doctor. If you have health insurance, though, and you don't have time to research, then I can see going to a doctor. But even then, your doctor is going to be rushed. They have so many patients, they don't really take the time to learn your case. A lot of them don't care. And a lot of them are out for the money. They just want you to pay for a surgery or pay for medications. They want to make money from you. You are a source of income to them. You're not somebody they care about or want to give the cheapest treatment possible or want to help get better as fast as possible. That oftentimes is not their goal. Surgeries are big money. They'll try to get you in surgery for sure. A lot of them. His rotator cuff surgery was $65,000. That $65,000 tossed in the stock market would be multi-millions someday. It's just ridiculous to get the surgery. His health insurance did not cover it because the surgery was done out of network, quote unquote. Typical. This guy's an idiot because he talks about all these surgeries and how he just keeps working. He hasn't let everything heal. He never lets it heal. He never fully rehabs it back to full strength and normalcy. He's always just quick to surgery and then skipping all the healing and just using it immediately. Working overhead. He even said he's been working overhead, which caused disc herniations. He's just out of control. Sometimes people need to just stop, quit their job, get some kind of online job, answering phones or whatever, start an online store, or just be unemployed, just be homeless. Whatever you have to do to let your body heal. No more moving it. Then after it heals, then you begin rehab. See, this guy says, I've been dealing with shoulder impingement for a year and 6 months. Let me rephrase that. He's been using a shoulder that was clearly damaged and flared up with a torn muscle for a year and a half. Just grunting through the pain, allowing it to tear worse and worse and worse until he finally has to address it. It's ridiculous. I allowed mine to get worse and worse and worse for 20 days before I got smart and started researching and found out I need to let this thing heal. I need to stop using it entirely. Some people are thick skulled and never address it until it gets so bad that they literally cannot even sleep at night. It's ridiculous. Had to stop going to physical therapy because of insurance problems. Do it at home. Like, people think because they're not attending a class that they can't do their own physical therapy. There are tons of exercises available online. No, actually, console. I can read every single problem these people have and answer them and give them a diagnosis and a list of things they need to do in order to solve their situation. But unfortunately, I'm not able to talk to these people, and a lot of these posts were made years in the past. I have a full knowledge of all things related to this. I'm a master of it. Really, at this point, once you've done thorough research, you just keep reading and reading, looking for anything you don't already know the answer to. And if you can read for hours without learning a single thing on a certain topic, then you have truly mastered that topic, and that's where I'm at now. Three weeks of gentle stretching and mobilization exercises designed specifically for rotator cuff, period. Search for these exercises on YouTube, period. And stretches. The goal here is to regain some range of motion get things moving a bit and begin to loosen up the shoulder, period. Applications of ice and heat. Ice, heat, comma, massaging, comma, resting, comma, and are still important to aid the healing process, period. End. Press return. Stage 3. 3. Colon. 3 weeks of space, YouTube, rotator cuff, exercises, period. End. Press return. Stage 4. 4. Colon. "10 weeks, paste, of, difficulty, end, period. Press return. Stage 5, colon. Continue daily weight training done daily, backspace, comma, done daily, rotator cuff, muscles, lats, latimus, muscles, comma, deltoid, deltoid, comma, trapezius, 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 trapezius muscle, arm muscles, arm, period. Idea here is to strengthen all supporting muscles for the shoulder and arms, which will protect the rotator cuff muscles from future injuries. And ensure long-term, successful healing and recovery for years to come. Period. Return. Surgical route, comma, still follow steps 1 through 5, through post-surgery. Press delete to ensure full, successful recovery and re-strengthening. Re-strengthening. Period. I would not recommend the surgical route unless you first try the non-surgical route and/or are confident the tear is so bad, tear, tear, that surgery is necessary. Period. For example, comma, the tendon has split completely in half. In half. With no hope of rejoining on its own. Period. Treatment. Delete. Space. Space. Beware of the fact that orthopedic surgeons will typically typically recommend surgery, cancel, surgery, cancel. Because they make big money that way. Period. Doctors. So use some discretion. Period. Stage 1, 4 to 6 weeks of complete immobilization with either a cast or a sling to help you remember not to use the shoulder at all. This allows proper time to heal. This phase is known as RICE treatment. Rest, ice, compression, and elevation. During this phase, get at least 8 to 10 hours of sleep per night and eat healthy and get plenty of vitamin C. Also take magnesium sulfate baths daily to soothe and relax muscles. Sit or lay down most of the day. Focus on resting and healing. Use of daily ice and heat applications on shoulder are recommended to improve blood flow and reduce swelling. Also, light massaging of shoulder recommended. Stage 2. 3 weeks of gentle stretching and mobilization exercises designed specifically for rotator cuff. Search for these exercises and stretches on YouTube. The goal here is to regain some range of motion, get things moving a bit, and begin to loosen up the shoulder. Applications of ice and heat, massaging, resting, and magnesium sulfate baths daily are still important to aid in the healing process. Stage 3. 3 weeks of light exercises done daily. Designed to let you stretch and flex your joint as far as possible. Search YouTube for rotator cuff strength training exercises. Applications of ice and heat, massaging, resting, and magnesium sulfate baths daily are still important to aid in the healing process. Stage 4. 10 weeks of medium difficulty exercises done daily. Goal to achieve full range of motion and begin to regain strength. Stage 5. Continue daily weight training for rotator cuff muscles, latissimus dorsi muscles, deltoids, trapezius muscles, and arm muscles. Idea here is to strengthen all supporting muscles for the shoulder and arms, which will protect the rotator cuff muscles from future injuries and ensure long-term successful healing and recovery for years to come. If you choose the surgical route, still follow steps 1 through 5 post-surgery to ensure full successful recovery and strengthening. I would not recommend the surgical route unless you first try the non-surgical route and or are confident that the tear is so bad that surgery is necessary. For example, the tendon has split completely in half with no hope of rejoining on its own. Beware of the fact that doctors will typically recommend surgery because they make big money that way, so use some discretion.
Good, Teddy Bear. Did you write it or did you find it?
I wrote all of that.
Good.
That was the summary of a lot of research.
That's good, Teddy.
Nobody had something that comprehensive. I want to post this in more places. I wish I could get it published on like a big medical site. I'm serious. People are really confused and people are getting surgeries that don't need it. And this is from a lot of research.
That's very good.
I don't know if it posted or not.
Where'd you post it? Where'd you post it?
On the comment section of a physical therapy as effective as surgery for rotator cuff tears article, which is published in 2014. It has like 200 comments. Well, at least I'll have my YouTube video.
What do you mean?
I don't know if it posted. It didn't show up in the comments. Maybe it's requiring my...
At least I have my YouTube video.
I'm gonna make a YouTube video covering all of that.
Really?
Yeah.
That's good, baby.
And then I'll also make YouTube videos covering all of the exercises and treatments I do. It'll be a whole video series on rotator cuff treatment. But the most important thing is for people to have a plan. So many people I've found will just not deal with it and it just gets worse and they just live in pain for years. And it never has a chance to heal. They just keep using the arm like nothing happened. That's what I was doing for 20 days. That's a huge mistake. It's never going to heal. It can even get worse. More swelling, more tightening of muscles means certain muscles tighten, causing imbalances. And then, boom, you tear something else or something more. The muscles tightening are telling you don't use it, but people just fight through it. Or take pain meds so that they don't even feel the pain and they work through it, making it even worse. Because now they don't feel when they're causing even more damage. It's horrible. And then, those that even do, so they let it get horrible to the point where they can't live with it anymore. The damage is extreme. And then, they'll finally go to a doctor. The doctor's going to want money, so they're going to say, oh, get surgery. They won't even recommend these steps. Never even comes to the question. It's just MRI, oh, it's torn, surgery. So then they get surgery, and then they go back to work right away. Maybe they rest it for a couple weeks, and then they go back to work. Then the pain starts, it re-tears, all this stuff. They never go through a rehab process. They never go through, so whether you have surgery or not, you always have to have 4 to 6 weeks of rest and rice. Rest, ice, compression, elevation, where it can actually heal and stabilize itself, and your body just calms down and you allow it to fully heal. And you also do heat and ice treatments, Epsom salt baths, magnesium sulfate baths, etc., allowing your body to be soothed, relaxed, and rest. And a lot of healing will happen during that, and a lot of inflammation will eventually go down as the body says, oh, okay, he's taking care of it. And then you begin rehab, which is many, many weeks. It's 3 weeks of very light stretching, very light range of motion exercises, just getting it little by little, starting to get your range of motion back and getting blood flowing back into it, helping the healing. And it's going to hurt a little bit, but don't push it too hard. It's just very light, minimal. And you're going to still on ice, take baths, apply heat to it, everything. Massage it. But it's going to be recovering and healing during all of this. And then 3 weeks of light exercise. Now you're getting into a little more resistance training, very light. You're still doing your ice and heat treatments, still doing your massages, still doing your magnesium sulfate baths, and you're still getting plenty of rest, and you're not using it as normal. You're still resting it. It's just daily exercises to slowly start strengthening it, slowly start getting back your range of motion little by little. And then another 3 weeks, or no, actually after that's 10 weeks of medium exercises, continuing with a goal of getting your full range of motion back and re-strengthening it, and also re-strengthening all of your other supporting muscles like your deltoids, lats, trapezius, etc., and your arm. And all of that has a goal of protecting it and strengthening everything surrounding it and related to it. Not just the little rotator cuff muscles surrounding the humerus bone, but everything around it helps too to protect those muscles which are still in a healing process. It takes a long time to heal. And then after that, you have to continue weight training and using it and exercising it and taking care of it and massaging it and applying ice or heat as necessary for years to come. It doesn't just stop. You don't just get to go hog wild and just never use it anymore, or use it too aggressively too soon and start lifting super heavy weights all of a sudden. You need to be very mindful of it, slowly, gradually continue to use it, getting full normal usage and building up your weights little by little. You have to exercise and strength train. A lot of people get surgery, 2 weeks of rest maybe, and then go back to work. Lifting heavy stuff, lifting patients, lifting couches, whatever, acting like life is normal. It's not. It takes years to build back the strength, the stability, get full healing, everything. And people just jump right back in, just not caring, acting like life is back to normal. It's not. So many years recovery, whether you get surgery or not. So I think people need to be educated on this whole process. I was able to gather all this information through a lot of research on all different types of sprains. And the same rules apply to pretty much any sprains anywhere in the body. And that's the procedure physical therapists will give you. A lot of people think physical therapy also starts immediately after the injury, and that's a big misconception. So, yes, you seek physical therapy, whether it's at home or with a physical therapist, right away. But that doesn't mean you're starting rehabilitation exercises and stretches and strength training right away. Physical therapy could be them just telling you, here's how to massage it, here's how often to ice it or apply heat to it, here's the kind of salt baths you should be taking, here's a type of whirlpool you should be using. You should be turning your shower head onto pulsation mode and spraying it onto the muscles to relax and soothe them. And they can be monitoring it, and you go back in for just verifying that you're doing all the right stuff and them just seeing how it's going so far. And that can go on for 4 to 6 weeks. That's the immobilization phase. And they can also prescribe you a sling or whatever. That is part of physical therapy. But people think if you say get physical therapy, that means instantly you're like hardcore pushing it to the pain and you're screaming and hitting the gym. It's like, no, that's the rehab phase.
Yeah.
So, physical therapy includes the rehab ice treatment phase. I mean, RICE. Rest, ice,
What about
compression,
compress?
elevation. What?
Compression.
Rest, ice, compression, elevation. In my opinion, compression is not actually good for a rotator cuff injury because all that's doing is pressing your deltoid against your rotator cuff muscles, causing increased aggravation, decreased blood circulation, and increased swelling and pain.
They
It
do
would
it
agitate it.
kind of like when you ace bandage your ankle or whatever.
Ankle sprains, knee sprains, etc., compression maybe would be a more viable option.
Shoulder. I saw on Amazon when I was looking for the sling. I saw a compression thing for rotator cuff tears.
I think most people use compression for people that are being ignorant and just trying to fight through shoulder dislocations and stuff and still go to football practice. And the compression just keeps it from dislocating again. It helps to keep it in the socket. It shouldn't be used for somebody trying to actually rehab and get recovery. It's for somebody that's just not dealing with the problem and they're just trying to put a band-aid fix on it and still use their normal day-to-day life. And I think that's wrong. You're possibly going to cause permanent damage and require surgery by going that route. You should take care of it. You should follow these steps to fully heal it, re-strengthen it, rehab it, everything from the ground up, beginning with 4 to 6 weeks of total immobilization. So I think in this case, compression is not the answer. Maybe if you're wanting to do like some stationary biking, maybe then wearing a sling and shoulder compression to really stabilize it so it doesn't move while you're doing cardiovascular exercise, just stationary bike. Or maybe walking at slow speeds on a treadmill just to get some cardio and get some blood flow and exercise and break some sweat. That might be a good time for it.
I didn't know because, like, for example, yesterday I was looking for the sling and the ice pack, and I put it in the Amazon to buy it. And I saw the compression thingies, and I thought, like, that probably limits more movement, like, if you're doing activity. Because if you have the sling, wouldn't you be kind of like some movement?
Well, I can say that I created a compression setup with two knee braces I had that actually one could kind of compress my shoulder, the other one could wrap around my side, and it pretty much was set up just like the purchasable shoulder compression setups. And after one day of wearing that, while just sitting in this chair, I was in excruciating agony. It was the worst day of my whole experience. It caused tons of swelling and impingement.
I looked at a sling article,
It
and
inflamed
says
everything. It was horrible.
the sling should not cause pain. That means readjustment needs to be made, and incorrect readjustment is
I said a brace, not a sling. A compression setup. Compression is very bad. A sling, though, might be fine. A sling or a cast. Some people have had a cast put on. I read it. Their doctor put them in a cast for 6 weeks. And I think that's smart for people that are just too thick-skulled to get it through their head that they are not to use this arm at all. I can really see as a doctor prescribing a cast. Some people will just keep using it. If they have mental problems or they're just the type that just wants to spit on everything and
No, you
walk
can
through
get a
it?
cast. It's a cast if it was a rotator cuff with kind of what that tells it avulsion or avulsion fracture. A lot of times casts are related to bones, so they probably fractured their scapula plus
Oh, there was no there
rotator cuff.
was no fracture involved. But I think that a cast is a good option for people that
I don't know, maybe.
have a hard time not laying it on it when they sleep or not moving it and forgetting not to move it. It takes discipline and willpower and complete commitment to truly immobilize it for 4 to 6 weeks. And a cast can help you if you have willpower issues where you keep being tempted to use it, to reach out for something when you're going to trip or fall or whatever. I think that's a smart move for people that are having problems really immobilizing it to let it fully heal for 4 to 6 weeks. But a sling is another great way. Now, I'm going the route of just laying or sitting in a reclined position all day, every day for 4 to 6 weeks. Except very rarely when I have to get up to like go get something or pee or something or take a quick shower. But almost exclusively I'm
About
sitting or laying.
exercise.
So that kind of is a sling. My arm's almost in a slinged supported position at all times.
What about exercise?
Exercise is off the table unless if you can come up with a way to exercise during your rice treatment period that doesn't cause any inflammation or pain or agitation to your shoulder at all. So if you can get a stationary bike and be wearing a sling with compression and just do that for half an hour a day, maybe that or something, but I'd be very careful, and most likely 4 to 6 weeks of no exercise is not going to kill you. I would recommend no exercise during that period.
Okay, well
But
then you
if you
cut
can
back
figure
on your
something out,
diet.
if you can figure something out,
No more pizza.
yeah, you probably will want to cut down your calories during this period and not eat as if you're working
That's
out
why
every
so
day when
many
you're not.
people come in the first place get injured and they come back not the
Yeah, you have to watch your diet during
they get fat.
the rice treatment
They gain
phase.
probably 20 pounds.
If you gain 20 pounds during the rice treatment phase, it means that you probably not only stopped working out, which is okay, but you probably also increased your eating and junk food and stuff because you're just sitting around all day bored and you're more tempted to sweets and stuff. And that's horrible. You need to be eating healthy
I
and
used to.
managing your diet
I
the
know,
whole
but still,
time.
a lot of them get fat, mostly all of them, and then that makes it worse. And then that's just suddenly from there on, after they get down, blah blah, and it's just like fat, just
Yeah, that's really a good point. That if you, during your rest treatment phase, lose control of your diet and get fat, and you're probably depressed because you're so inactive you can't do all the things you normally do, so you're dealing with mental health issues on top of everything. And then, yeah, I can see that being a real problem. So I think it's important to keep your self esteem high, stay in a good routine, figure out what you can do while you're in this somewhat de- debilitated state, and try to stay in a good routine and maintain as positive mental health as you can and maintain hope. Mental health is part of healing. So you should get a lot of sleep and try to be as active as you can within the limits of not agitating the shoulder. So I think that's a great point. I noticed that in my first 10 days of my rest treatment, rest ice compression elevation, I suffered from getting out of my normal routine and was feeling depressed, and I couldn't do all the things I normally do. And I did eat worse. I started eating more junk food and stuff. So I'm turning that around now. I'm creating a to-do list of things that I can do with one hand without agitating my bad shoulder. And I'm going to be active within my new limitations. I downloaded a speech recognition software program so I can still interact with my computer without typing, and I can still do video editing. I can still do a lot of things. I'm going to create a comprehensive list of all the things I want to do, and that's going to help me a lot. I really hope that the videos I'm going to be making on my journey and on all the proper treatments as I discovered from research from really reputable sources and physical therapy websites and stuff will help a lot of people and help a lot of people to avoid surgery because there's been studies that in many cases surgery re-tears where you got the surgery and you have to get future surgeries and oftentimes there's going to be scar tissue and you're not going to heal as well as if you just did it naturally through physical therapy. And in also these studies, it showed that in general there was no improved recovery for people that did the surgery versus people that went the physical therapy route. And again, physical therapy doesn't mean first day after the injury you're lifting weights to try to re-strengthen it. No, that's retarded. 4 to 6 weeks immobilized, nothing. 3 weeks, gentle mobility exercises, gentle stretching, slowly getting back range of motion. 3 weeks, medium exercises, slowly getting back range of motion. Then 10 weeks of continued range of motion and strength training. And I highly recommend people to buy those resistance bands. It's like a rubber band, and you can tie it. It's like a rubber band for office work, except it's like wider. It's like a belt, and you can get different elasticity belts like this, and you can tie it on a door handle or something, and just do like stuff like this,
Yeah, I have those.
which is for your rotator cuff.
I have those resistance bands.
You can do this way, and then you can tie it to one on that side and do it this way.
Yeah.
So you're opening and closing, and that's directly rotator cuff strengthening. But that's not even till like 4 to 6 weeks of immobilization, 3 weeks of gentle mobility and light stretching, 3 weeks of medium exercise, and then 3 weeks of strength training. So it's not till you get to the strength training portion. So that's a lot of weeks away from the original injury before you're messing with that stuff. It's like months before you start that. And another very important exercise I learned from Dr. Bergman on YouTube, who's a very famous, 500,000 subscribers chiropractor on YouTube, is holding a 20-pound weight, palms up at your side in both arms, and then just going forward and back, about to where your back of your butt is to front of your stomach, back and forth, while standing upright, not sitting reclined like this, while standing upright. And what that does is it gets back some motion into your shoulder, and the weight, if you're a light, small frame person, maybe a 10-pound weight. If you're a bigger guy like me, 20-pound weight. The weight helps to drop your humerus down into its normal position, because when you're injured, your deltoid tightens up and it wants to pull your humerus up. And that's why when you lift it, you can't, because there's impingement. It's hitting the top of your scapula. It's grinding up all the nerves and tendons and everything in there. You can't raise your arm. But by doing that exercise like this, it helps to loosen, stretch out, and lower and relax the deltoid muscles and drop the humerus back into its socket so that you can raise your arm all the way up again. It's a very important exercise. You should do that daily.
Ow!
Yeah, you need to be doing it then. That will help you a
This
lot.
is tight.
He said it also reforms, I believe, the sacrum. It's the sac that surrounds the humerus, and it's the cartilage also. It reforms it. The labrum, okay. Yeah, it reforms the labrum and the sac that fills with fluid. The bursa sac. So it reforms the shoulder joint. That exercise where you're holding a weight and just going back and forth. And I'll be demonstrating that for sure when I'm doing that daily on my channel. I believe his name's Dr. Bergstrom. Let's see. Hold on, baby. Not Bergstrom, it's something like that. Dr. John Bergman. Bergman. Dr. John Bergman. I highly recommend checking out his videos about rotator cuff injuries and shoulder pain, as well as his videos on all kinds of subjects related to healing and how spinal health and shoulder health all works from a bone structure angle and blood flow angle, and how diet plays into everything, and how healthy food aids in healing. There's a lot that he can offer you for all kinds of ailments, pretty much anything. His channel covers possibly thousands of topics relating to healing and health and recovering from any injury you can imagine, as well as any ailment from diseases to rashes, you name it. It's just a information gold mine. We are live, Pizza Hut. So what were you saying?
Should I just get the sling and that?
Sling and gel pack that could be hot or cold.
What, is that the one that was on your thingy?
Yeah,
The Flexicold?
yeah, I should probably get it, yeah.
It's the one that's hot and cold?
I'm only in day 10 of a approximately 40-day rice treatment plan. So I still have 30 days, a full month, of ice and heat applications, Epsom salt baths, massages, and total immobilization. Oh, and by the way, also during that period, it can be good to get ultrasound treatments and or um, electrical therapy, which can help the healing. What are your thoughts on ultrasound therapy and electrical therapy for aiding in healing and soothing, relaxing your muscles?
That's good.
I have a Meridian energy pen, which I bought on eBay. It was like $8 to $10, and I'm thinking of using it. It's basically like an acupuncture pen, I guess. It's supposed to be Eastern medicine. It's basically electrical therapy, and it should aid in healing, I believe. It sends electrical impulses at low voltages into your body. It can be used to prevent some of the muscular atrophy and frozen shoulder as you go through your 4 to 6 weeks of rice treatment, rest, ice, compression, elevation. It can also help aid in healing and blood flow, I believe.
Yeah, I think it's great. I just found it's called the TENS unit.
Yeah, it's also called a TENS unit.
I'm gonna get that.
You're gonna get it.
Yeah, it's not
I have one.
it's not a TENS unit.
This is.
The little pen?
Yeah.
No, this is different.
What's the one you're looking at?
You put like pads on like pad here, pad there, and then you can move the dials to the amount of stimulation that you want, and it can stay there for like maybe 5 minutes, and you'll just have to go like this, so it's kind of like pulsing the muscles.
Oh, I'll take it.
Yeah.
Okay, my wife just said she's buying me a TENS unit, which is a series of pads that are placed strategically throughout the shoulder, and you set the amount or the amount you want, and it sends pulses into your shoulder. I'm guessing, does it cause the shoulder to contract and release?
Um,
Sends electrical energy at low voltages into your body. and this is coming from basically Eastern medicine, but it's relating to things like acupuncture.
And it helps to it's also just
This is
about to
ancient Chinese technology
relieve pain.
for healing. It's used for pain relief and prevention of muscle atrophy by basically, it's like if your brain tells your muscle just to gently contract, it does that for you. So it's like a pulsating contraction. Now, people sometimes take this to the extreme and stick a bunch of pads on their stomach, crank it all the way up, and cause their abs to flex while they're watching a movie, and that can like give you shredded six pack abs or something. In theory, and I guess you could do that throughout your whole body. Um, but that's like ultimate lazy man's way of like getting muscles.
Actually,
Um,
this helps more with pain relief.
okay, this is more for pain relief, but I think like a higher voltage version of this could be used for that. And I think it's in the video game Metal Gear Solid, one of the most recent installments. He came out of paralysis, and the doctor told him that they prevented a lot of his muscle atrophy. He was paralyzed for years by electrical stimulation of his muscles. And my Meridian Energy Pen actually says that you can use it to prevent muscle atrophy on muscles that you cannot move for whatever reason, such as muscles that are underneath a cast. Let's say you have a cast for a broken bone. You can use one of these pens over the cast to cause muscles underneath the cast which you can't move to flex and prevent them from completely freezing and getting really bad atrophy. So I think that's really interesting. Might not be a bad idea. Electrical impulse will help muscle ache, pretty much, yeah. But for muscle ache, also a good recommendation is um, magnesium sulfate baths. Those are magnesium and sulfate, basically Epsom salt baths, are intended to provide relief for sore and aching muscles and minor sprains. The magnesium sulfate actually soaks into your body through your skin as well. You put 2 cups in your bathtub and you fill it up with hot water and you lay down in there for 20 minutes and it's soak. You can put a towel in hot water and add the Epsom salt and probably use less Epsom salt that way, but I think it's better to do a full body. Besides, I was thinking like, how would you put a hot towel compress on a sore muscle? Well, I guess if you lay it on like a picnic table, let's say you had a sore back and you put the towel on your back while you're laying outside getting suntan, maybe something like that would work. But for indoor use, that doesn't seem very practical. I don't know how I would use something like that. So I just assume take a bath. Yeah, I know you can use stem cells to heal your shoulder. I've seen Regenokin and Regenex as shoulder healing aids, um, either using stem cells from aborted fetuses or using your own stem cells in the case of Regenex, which is more ethical depending on your moral situation. Um, However, you can even use stem cells from your own or your own child's umbilical cord, which is not unethical at all. But the argument for not using stem cells from an aborted fetus would be that it creates a demand for abortion, which then would create an industry that has a goal of encouraging young mothers to abort their children so that they can get more stem cells, which are highly valuable, worth their weight in gold. So people will be aborting kids left and right, even if they wouldn't have otherwise aborted, and that could lead to bad things and bad decisions. So last thing you need is doctors begging women to abort, and then the women regret it and feel depression and suicidal thoughts afterwards, something like that. Hold on, let me look it up. Um, FlexiCold, FLEXIKOLD gel ice pack. Standard large, 10.5 inches by 14.5 inches. 2 reusable cold therapy packs for pain and injuries to knee, shoulder, foot, back, ankle. It's available on Amazon for $27.99. These are really large ice packs that are designed to be very flexible even when freezing cold, which is different from gel packs, which get hard as a rock, and you can't flex them around your damaged joint. So you pretty much have to wait half an hour after taking it out of the freezer to even be able to use it. It's a pain in the butt. These ice packs use modern technology to somehow be very flexible even when freezing cold, and that's really nice. They can also be used, I'm pretty sure, as heat packs, and I'm not sure how that works if you put it in the microwave for a little while or what. Maybe you'd put it in the bathtub under hot water or something like that, and then you can use it to apply heat as well. Something like that. Or you could just buy a Therapist Choice king size moist dry heating pad, 12 inch by 24 inch for $19.99, which I also put on my Amazon wish list. Should you do that?
What?
Buy Therapist Choice king size moist dry heating pad, 12 inch by 24 inch for $19.99. Instead of using my ice packs as heat packs, I'd use a heating pad for heat.
Oh, you're saying the cold for ice and then the heat for
Yeah.
heat?
So I could keep the ice packs in the deep freezer and then have a heating pad which I use to heat it between ice treatments.
Yeah, I can do
I think that would be better.
that. Let's see.
Yeah, I got hurt. I tore my rotator cuff in a kayaking accident, and I didn't rest it properly, so it continued to tear, and it got worse and worse over a 20-day period until it got to the point where I was in excruciating agony, having a hard time sleeping, feeling pain no matter how I sit or how I lay in bed.
Well,
And I realized I needed to take action, so I then began researching, um, and I realized right away from my years of sports injuries that the most common sense biggest thing I missed is just not using it at all. No exceptions. That means complete immobilization of the joint. My problem was my shoulder was kind of hiding its symptoms. I'd feel okay most of the time and I was using it as normal. That was a mistake. You have to allow it time to fully heal, and that means not using it at all.
okay. Is that all that thinking?
What?
So I have the moist dry heat pad, Thames unit, arm sling, and flexible ice pack.
Yes. Um, Total it up, and I'll pay you back half, because you can use all this stuff for, like when you have a period, you can use the king size heating pad,
Yeah.
and the ice packs for your own injuries, or if you're having your shoulder bothering you or back bothering you or whatever. And pretty much all this stuff you'll be able to use. And I'm gonna create a Smarty Pig goal to pay you back, and I'm gonna contribute like $3 a month to it until I meet the goal. Then I'll pay you in a lump sum. That's okay.
Yeah. It's only 45.
45. Okay. Start listening. Open Notepad. Create Smarty Pig goal. Baby, could you look up and maybe buy me also green resistance band for exercise?
Oh, I mean, I've never heard of it.
Yeah, but you can't steal it from me, can you?
Can steal it.
Then why do you even bring it up that you have it at work?
You just cut it. Cut a piece. Just cut a piece. It's part of a roll, big roll.
Is it reusable?
Yeah.
So, oh, you cut a piece and just give it to clients, to patients?
Yeah.
Can you cut me a piece?
Yeah.
Ask the doctor if it's okay.
Yeah.
Great, okay. They have different colors for different resistances.
And we have green in our office. I don't know if we have other colors.
Oh, really? Okay, then I'll just take green. But then maybe
They
I'll
might have
buy
some
like
next door.
red or some other hardcore one
They
once
might
the
have
green gets
some
too
other
easy.
next door. But I'll ask. Let me see. Siri, remind me Monday.
I think that the medical industry is corrupt by big pharmaceuticals and a quickness to prescribe drugs that get you addicted, opiates, in the pain management industry, as well as corruption in a quickness to overprescribe surgeries, even when therapy and natural healing methods would be better because of greed for profit. Um, so I think it's very important for people to use the resources at their disposal on YouTube and on Google to search for the knowledge to make their own decisions without any biases that a doctor can often have in the greed for profits. I'm really smart, thank you.